that I'd like to talk about, which is not seen as a typical mental hospital and which doesn't fit into the 42 other hospitals that we've spoken about, is the Banyan itself. Now, various mental hospitals have sizes, so the typical number is anything ranging from 200 to about 1,000, 1,500. So at the Banyan, we reach out to about 200 people. It was 400 at one point, and at that point I saw that quality really dipped. But now it is 200, and we are a typical mental hospital. Only thing is that the number of psychiatrists that we have is lesser. The number of other mental health professionals like social workers, psychologists, and other community and healthcare workers is far greater in number. And what have we seen at the Banyan? We've seen that the ethos are our strength, and because we believe that compassion, transparency, discharge, treating an individual as an individual and then as a person with an illness has really worked. And these are mandates or philosophies or ideologies that are ingrained in our system. So it's part of our training system. So I think that has worked for us. Our leadership has worked for us. And yes, I'm being modest here. Our monitoring system has worked for us. We have constant monitoring mechanisms, both internal and external, constant reviews. And I think at the core or at the heart is the fact that our program is driven by our clients. So at on a periodic basis, so at the moment it's on it happens twice in a year, but typically I'd like it on a quarterly basis. We review the entire program, and the people who review it are the clients and the caregivers. So if feedback received from them is taken seriously, and if it then is incorporated into the overall operation of the hospital, I think that's the best way in which one can run a hospital. Now, having said that, I come to the last part of my discussion, which is, okay, so we've looked a little at the history, we've looked a little at my stance, we've looked a little at the hospitals today and our engagement with one or two of the hospitals, and we've looked a little at the Banyan. So what are the action points that I propose? One is based on our experience. Clearly mental hospitals need to be mental hospitals or psychiatric institutes or whatever that you'd like to, or centers of excellence, but they need to be small. I don't think we should exceed 200 or 250 at a max, because the quality clearly dips. Two is all the basic amenities that we're talking about, whether it's water, food, toilets, they need to be taken for granted. We've debated over these and intellectualized and talked about human rights atrocities and all sorts of things for the past 50 years, and unfortunately these are the very basics. These are things that are constitutionally entitlements that every person should have access to. So this should be an absolute must, and these are non-negotiables. Once we do that, I think we need to bring in the philosophical constructs into the care paradigm. Unfortunately, what is happening is we are operating now without a mental health policy. We have the amendments that are being worked on, but we don't have a clear policy. So we don't know that, all right, this is what our country says. This is how we approach the issue of mental illness. This is how the DMHP operates. It's out of 626 districts, we have only 125. What happens to the balance? None of this is being approached in a strategic manner. So without the mental health policy, we don't know what mental health services are. We don't know who plays a key role. We don't know who the mental health professional is. It's all very scattered. It's all very sporadic. So what happens is the perception for a layperson or for a client or for a caregiver is also the same. It's very sporadic. So if you have a movie that marginalizes or stigmatizes a person, then that's the perception or takeaway. If you have a psychiatrist being depicted as a powerful, rash person, then that's the takeaway. If you have a warder being the person who abuses all the while, then that's the takeaway. So without a mental health policy, it's impossible for us, I think, at this stage to move forward, especially with this sort of prevalence rates that we're talking about. So I think it's essential that we get a mental health policy, and when we do that, we don't ape the West. So yes, there's the UNCRPD, which is very good. Yes, there's the rights perspective, but what is rights in India? While we talk so much about indigeneity and indigenous methods of treatment in mental health, I think it's also important that we look at human rights from an indigenous perspective, and I think poverty will play a key role there. So once we get these sociological, philosophical and cultural aspects, and once we are clear about the mental health systems, who does what in what proportion, what are the services, if the mental hospital is one, what is the role of civil society, what is the role of NGO, what is the role of the user survivor movement, what is the role of mental hospitals. Once we have that mandate, then we work on the staffing and refresh it entirely. There's no concept of transfers. There's the staff who paid there 30 years ago are still stuck. So I think staffing is something that needs to be looked at in great detail. And once we do that, we also look at training, because training cannot be the way that training goes on now. Training has to change. Clearly, training hasn't, while we've been speaking training for a long while, it hasn't brought the sort of results that we'd like in the mental hospitals. The most important aspect that I'd like to come to now is the leadership aspect. I think what is critical is for us to have good leaders in the 42 mental hospitals. If we have that, a lot else will fall into place. Which is why I constantly reinforce and cannot stop reinforcing the importance of management principles in the mental hospitals. Clinicians are experts, mental health professionals are great, user survivor movement is brilliant, but if we have to have processes and a clear mandate, then it's essential that we have management-driven strategic systems with clear monitoring systems, with clear impact assessments being done periodically. Once all these protocols are created, I think we can create regulatory bodies, which is something that we've spoken about. The NHRC has constantly prescribed guidelines. Unfortunately, none of us has stuck to it. There have been lapses, and the NHRC really doesn't have teeth, so nothing much has happened at the end of it. Hospitals have continued, atrocities have continued, unless somebody makes a hue and cry and NGO reacts. There is a newspaper article, but this cannot be the way the regulatory body has to be formed. So if these points of size, of basic amenities, of ideology, of staffing, leadership, a management-driven system, and a regulatory body is drawn into the mental health policy, I think we can see a lot of change. Lastly, if we look at the Banyan, in many ways it really is a mental hospital. So if I were the government, what I would do is, in addition to the 42 typical mental hospitals the government has created, look at newer structures that have emerged. The Banyan is an organization that's taken care of its funding all these years. It's not dependent on the government for anything. If at all, there is the Swadhar grant, the social welfare grant that's funding the Banyan as a mental hospital. So I would look at the government pooling in all resources, mapping them and saying, all right, I have 42 mental hospitals, but I have other emergency services run by private organizations. Let's get all of this together, and why not then use the Banyan as a center of excellence? Why not use the Banyan as a training ground? Why not use the Banyan as a mental hospital? And maybe a mental hospital that focuses specifically on the needs of homeless people, but again with capped numbers. Now these are the out-of-the-box lateral thinking systems that we need to think of. We cannot stick to the old traditional model saying mental hospitals are needed or not needed. It's not as clear as that. These are grey areas, these are complex issues, they are nuanced, they call for nuanced approaches. So what we need to do is look at out-of-the-box thinking and say, all right, I am ready to focus on intellectualization, sure, but a lot of action experiments. And if I do that, I know that I need to first start working on the 42 mental hospitals and show some results. And believe me, if we show these results, we will clearly be able to change over a period of time the way in which a person perceives not just a mental hospital, but a person